This is Michael Smith of MedPage Today. I'm here at the ASTRO meeting in Boston. I'm speaking with Dr. Dwight Heron of the University of Pittsburgh Cancer Center. With colleagues, Dr. Heron is presenting data here on what appears to be a barrier to participation in clinical trials for older Americans. Dr. Heron, what did you do? How do you find out about this?
Well, we found out about this because we have a program sponsored through the NCI, it's the Radiation Oncology Community Outreach Group, ROCOG for short, that has been charged with evaluating barriers to the participation on clinical trials, in fact, cancer care in Western Pennsylvania. As a part of that project, we looked at the participation of patients on clinical trials, specifically patients who had Medicare HMO. Now, there's been an insurgence of enrollment in patients on these HMO plans since the Modernization Act of 2003. We've seen an insurgence of patients moving from fee-for-service Medicare services to these Medicare HMOs. And what was not recognized, perhaps then and even now, by our patients until it's too late, is that there's a clinical trials donut hole. Essentially what that is that patients who are on Medicare HMO, if they agree to participate in a clinical trial, suddenly their coverage for their cancer care services revert back to the fee-for-service without the supplemental insurance, or they're now suddenly liable for 20% of the cost of their care.
That can be a huge amount. I think in your study you looked at the monthly cost per patient if they were involved in one of these trials and were in an HMO. What were the costs like?
The costs were actually quite remarkable. If you think about it, these are patients that are on fixed incomes frequently, and for the number of clinical trials that we looked at, there were about 5 of them. The monthly cost ranged from $100 per month to $3,000 per month. And you can imagine for folks who are on fixed incomes, even $100 per month is a significant burden. So not surprisingly in our study, virtually all of those patients would say thanks, but no thanks. They would in fact say, we don't want clinical trials, I'll just go ahead with standard of care therapy. And as a result, those costs for the care would be fully covered by their Medicare HMO.
I see. Now, one can argue that perhaps this is merely this is a political, bureaucratic thing, it has no implications, but you argue, in fact, that it does have clinical implications.
Oh, absolutely, there are clinical implications. I think it's generally accepted in medicine that patients who are treated on clinical trials get better screening, they get better care, and their follow-up is far better, and not surprisingly, their outcomes are much better than standard, quote-unquote, standard of care. So this is why participation in clinical trials is so important. We clearly know that the way we make progress in medicine, frankly, is predominantly through clinical trials. It's how we set the next standard of care. It's how we get better and better and better. And so if we have a population that's not participating in these clinical trials, it's actually to our detriment in terms of the evolution of quality medical care in the United States.
And, of course, not good for the patients as well.
And not good for the patients as well.
Dr. Heron, thank you for your time.
Thank you very much, Michael.
I'm Michael Smith, MedPage Today.